Okay, we're going to talk about taking a full mouth survey now. Somebody read extraoral definition.
A radiographic technique where the film is placed outside the mouth when exposed.
Okay, so give me an example what you think that might be.
The film is placed outside the mouth.
Like in a panoramic x-ray?
Yeah.
Okay. A panoramic
Yeah.
x-ray would be an extraoral x-ray. An intraoral, go ahead and read that.
A radiograph technique where the film is placed inside the mouth when exposed.
Okay, so extra means outside and intra means inside the mouth, okay? When we do radiographs as needed for diagnosis, that's the only reason they're ever taken is for diagnosis. The dentist will often request a full mouth survey. A full mouth survey shows all of the teeth, including the crowns and the roots, and this is done by using two intraoral techniques. One is the periapical, or the PA. Periapical, what do you think that word means?
I know you get to see the whole tooth.
Peri means around, right? And apical means apex. So it's around the apex. So this would be a periapical because you can see the whole tooth, including the apex. Okay? The second way is a bite wing. Bite wings show upper and lower teeth together, biting together, and it's for posterior teeth generally. There are vertical bite wings that you can take on the anterior. They're not done very often. But the bite wing records the crowns, proximal surfaces. What's proximal surface? Between the teeth of both maxillary and mandibular teeth at the same time, in the same radiograph. Okay, so that's the definition of your two different types of x-rays that is on the test. They will ask you, what can you see in a periapical x-ray? So the answer would be the apex. You want to see around the whole tooth, including the apex. Okay, what did I do with my glasses? In my pocket. Okay. So if you're looking for the proximals, interproximals of the teeth, proximal surfaces, what x-ray would be better?
Bite wing.
Bite wing. If you're looking for pathology, say with a toothache, the patient comes in, they have a toothache, where is an abscess going to occur? At the apex of the root. And so you would take a periapical to check for that. That's the two different criteria, or two different criterias for taking those two kinds of x-rays. Another type of a radiograph that's intraoral is called an occlusal. An occlusal is done when you take the film like a sandwich. Okay, I'm going to use this film packet to demonstrate with this model. So if I'm taking an occlusal, it's going to show the occlusal surface. So it's going to be a weird looking kind of an x-ray, really. We do this on children a lot of times when we want to see what their front teeth look like. So you would put, like a sandwich, you would put the film between the teeth, and then this, because the white side, that's where the white side goes towards the light, white towards the light, so that's the proper way that the film is exposed. So you would come and take the picture from this direction, okay? So the patient's sitting here like this, and you would take the x-ray like this, okay? To take the lower. Now to take the upper, you would flip the film the opposite way, place it in the mouth, and then you would take it from the top. Okay? Because the lead back foil is on the back, so it would be upside down if you did it the other way. So the white towards the light is the rhyme, or whatever you want to call it. It's white towards light. Okay. In the modified long cone paralleling technique, which is the technique that I'm teaching you, the method for taking intraoral full mouth series will result in the following radiographs. Next page, please.
Oh. Hello? Oh wait, this was the end of the book. And then I gotta go to the next. What? Hold up.
Book 3.
Let's put.
Book 3, 15 through 26.
There we go. Okay.
I forgot about that part.
Okay. There we are. Okay. So, we're going to, a full mouth series is going to represent, this is for the test, okay? This particular question and answer is for the test, and I'll tell you the difference later. We have, one way is the way we actually do it in the office, and then the other way is for the test, and I'm going to teach you both, okay? So when I say it's for the test, write down for the test, okay? So, this is the answer to one of the questions here, okay? So we're gonna take 4 bite wing projections, 2 on each side. We're gonna take a premolar bite wing and 2 premolar bite wings, right and left, and 2 molar bite wings, right and left. Barb, are you playing music? That's for the bite wings. For the periapicals, we're going to take 14 periapicals. We're going to take 2 central incisor projections, 4 lateral incisor canine projections, 4 premolar projections, and 4 molar projections. So it would represent in the mouth, it would represent, for the periapicals, we're going to have an upper right molar, an upper right premolar, a lower left molar, lower left premolar, upper left molar, upper left premolar, lower right molar, lower right premolar. Okay? Then we're going to have anteriors that we have to take. So we're going to take a canine lateral, central, and a canine lateral. 2 centrals on this. It's 2 centrals. Okay? And then we're going to jump down and do canine lateral, 2 centrals, canine lateral. And that's going to give us 20 radiographs total. So the answer of how many radiographs are in a full survey, the answer is 20. When we actually start taking x-rays, to do a full mouth series, we utilize 18 x-rays. We don't change to a size 1 film receptor, image receptor.
20?
Yes. So the answer for the test, question number 5, is 20. I told you she took my notes, you know.
Question number 5.
Yes.
So we know question 5 and question 100.
There you go.
Be prepared.
See how easy this test is going to be?
Yeah.
I've given you all the answers. I told you I was going to give you the answers.
I wish every test was like this.
I'm going to give you the answers in this room
Don't
today.
report us, though. Don't report us.
Yeah, I'm going to give you the answers to the test today. So when you take the test in 2 weeks, maybe you remember it, maybe you don't. That's your problem.
Very true.
Okay. So, supplemental projections may also be taken. For example, a distal molar projection is sometimes requested. Okay, I really need another piece of film that'll fit in that holder. Let me. Okay. When you have a third molar, usually it's on the lower. When there's a problem, it's usually the lower one, that you just can't get it in the picture. Just can't get it in the picture. There's a way to take that x-ray without difficulty. But you have to do what's called a distal molar projection. And that's when you're going to angle the film, instead of having it parallel to the tooth, you'll angle it more towards the mesial. And what that's going to do is it's going to take the image here of this third molar, and it's going to project it forward onto the film. Okay? So you're not actually getting way back there because sometimes there's just not room. Christy, one of our assistants who was here in the office when I was here, she had a third molar that was trying to come out, and it was just wasn't going to come in. It was impacted, but it was just really flared up and irritating, and she could hardly open her jaw. So there's no way. I mean, I could get the film in like here, you know. There's no way I'm going to make her put up with me going back there. So I utilized the distal distal molar projection for her radiograph, and we were able to see it. Doctor was able to take that tooth out for her without any problem. He was able to see what he needed to see. So sometimes you have to throw the rules out just to get the right picture. As I was saying with the student that I had problem with the other day, because she could, it was on that same side, she couldn't get this first premolar in the picture. And I showed her how to, again, project it, angle it, project it, just a little bit. And she'll be thrilled from here on out because it'll be a lot easier to her. So I'm going to show you those kinds of things when we get into lab with this. But that's the definition of a distal molar projection. Okay? So we're going to prepare we're going to take x-rays now. So let's prepare our patient. The patient should remove glasses and all removable dental appliances. Why do you think, why do you think we need to remove glasses?
Can it hinder the picture?
Yes, but why? Good question, huh?
Yes.
Okay, do you know that glasses lenses have lead in them?
I did not.
Now you do. Lead keeps the x-rays from penetrating, so you're going to wind up with a cone cut. You'll have a blank spot where they were. As far as dental appliances, we have them remove their partial dentures, or let's say the patient has a retainer or something. You want to have all those appliances taken out, not the permanent retainers, obviously. But if it's removable, we want anything that's removable taken out, because the metal in the partial is going to obscure the anatomy because it's metal. It's not going to go through. It's going to show up as white on that radiograph, where we need to see shades of gray.
But
So
it's fine if they have like an implant to see
Yeah.
the screw, because that's not.
you can't, if it's not removable.
Yeah.
It's not removable.
I hope not.
So if, anything that's removable, and that includes tongue rings, tongue piercings, I have them remove them because, for a lot of reasons. One, I use it as a hygiene technique, a hygiene education, because most people don't remove them and brush them every day, twice a day, and it should be removed and brushed twice a day. I had one guy, he had such a hard time removing it because it had a huge
So much
lump
on
of
it?
calculus on it. So, you know, having him remove that and me showing it to him, putting it through the ultrasonic with tartar remover, stain and tartar remover, and then cleaning it real good and giving it back to him, he goes, well, I just swish with Listerine. I said, it can't get into your tongue. It can't, you know, rinsing is not going to do it. You have to physically take it out, brush it off, then you can put it in the Listerine if you want to, but just swishing with Listerine is not going to get it. So if it's removable, I have them remove it, okay, because it can obliterate and obscure the pictures. I had a situation in an office. I was taking a full mouth x-rays on this lady who had diamond studs implanted in her cheeks. She couldn't remove them. And we were not able to read her premolar x-rays properly because it obscured the premolars. So we had to do our the doctor had to do the diagnosis
Without
without
X-rays?
that. So we had to put in the documentation,
Yeah, for insurance.
you know, just because it was obscured that way. So you want to have them remove their glasses and any removable dental appliances. You want to remember your safety precautions. You're going to cover the patient with a lead apron and apply a thyroid collar. When?
Always.
Always, always. It's an immodal term, okay? It does for now and for always, from now and for eternity. So position the patient in a position for your comfort. The head is stabilized on the headrest, okay? You don't want them to be in the lowest position. You want to raise that chair up so that you're not having to bend over. Because if you're having to do this 7, 8, 9 times a day, plus for years, by the time you've been doing it as long as I have, you're not going to have much back left, okay? So you want to raise the chair up so that the patient is eye level with you, so that you can move straight forward without having to bend over or reach up. Okay, for maxillary projections, and you might want to star this question, this little thing. For the maxillary projections, the chair may have to be lowered a little bit so that you can see adequately in the maxillary arch. And the same for mandibular projections, you may have to raise the chair just a little bit. I remember seeing something like that on the test. Okay, so we've got our and remember your occlusal plane. You want your patient with the occlusal plane parallel to the floor. They're comfortable, they're stable in the headrest position, but you want to have it to where the occlusal plane is parallel to the floor. Okay, when we prepare the equipment, we're going to put on protective gloves to prevent exposure to the patient's saliva and keep the outside of the film packet clean. We're going to use F-Speed film. Why are we going to use F-Speed film?
Because it's fastest.
It's the fastest film. We're going to arrange the film in on a clean surface away from the x-ray beam, preferably in an adjacent room. We're going to provide a cup for transporting. We're on the next page, dear.
Oopie, I'm so sorry.
That's all right. We're going to provide a cup for transporting the exposed film to the darkroom. We're going to provide a paper towel for wiping the saliva off the film packet after exposure. We're going to provide the film holders for use for anterior and posterior projections. We're going to provide bite wing tabs for holding the film packets. This is a bite wing rin, but there are also bite wing tabs that are stickers that stick onto the back of the film packet. Like this, okay? And then for bite wings, the patient, you place it in the patient's mouth, they bite down on that tab, and it holds the film where it's equally on the maxillary and the mandibular. So that's how the bite wing tabs work. Okay? Make sure that the x-ray machine is turned on and adjust the control settings for the first radiograph that you will take. Sometimes it is recommended that you start with the anterior projections because the patient is less likely to experience discomfort. I want you to highlight that. I don't have it highlighted in my book. I need to have, you got a highlighter somewhere? Is it right here? Yeah, there's one. Cool. Okay. So you start, just highlight from where it says you start with the anterior projections because the patient is less likely to experience discomfort. That is a question on the test too. Okay, in practice, we actually start with the posterior. But for the test, I want you to know that we start with the anterior teeth. Okay, I don't want you to be confused because when we go back there and start actually working on taking these x-rays, we're going to start with the posterior teeth.
Yes.
That's the way our computer program has us do it, and that's the way we're going to do it. But for the test, you start with the anterior teeth. Okay? Then we're going to move on to exposing the film. After preparing the patient and the equipment, you're ready to begin to expose the film. The following are basic steps that you will take for each radiograph in the survey. One, we're going to load the film into the film holder, making sure that the embossed dot is placed into the slot. Dot in the slot.
Does it matter if it's like on the left or, oh, well, I guess it goes towards the light, so.
It'll automatically happen. Okay, you're going to put the dot in the slot with the white facing towards you. The white side facing towards you, or towards the circle. There's a way to, you're gonna have to learn to put these together too. Okay, so we're gonna put the white sort towards the ring, dot in the slot. Where's the dot? There it is. Okay, so the dot in the slot. And you want it in the center of that tab. Okay, see. See how that looks? See how that looks? Okay. All right. The white side of the film is always placed away from the back support. Away from the back support. Size 1 film for narrow anterior projections are placed vertically in the holder. This is, we don't use size 1. This is all size 2. It's all size 2 sensor. But size 1 would be for anterior teeth, okay? Because it is narrower. So we're going to put the white away from the back support, dot in the slot, and it goes vertically. Okay? Can you see that? Can you see that? Okay. All right.
Next page.
Size 2
Oh,
is
okay.
size 2 is the horizontal, and it goes horizontal into the yellow one for the posterior teeth. When placing the film in the patient's mouth, you want to tilt the holder to avoid impinging on soft tissues. You want to allow the patient to direct the film with the proper position as he closes. So for anterior, let's say we're going to take the left side canine lateral. We're going to come in like this. We're going to tilt it when you're going in so you're not impinging on soft tissue. And then have them bite down on the bite block. And there you go. That's for an anterior canine lateral. Okay? When placing the film in the patient's mouth, tilt the holder to avoid impinging on the soft tissues. Allow the patient to direct the film to the proper position as he closes. Help him direct it with your hand on the XCP. Don't attempt to direct it for him, okay? You're gonna put it in the right spot, at the right angle, and just have them close to seat it, okay? When placing the film, observe the following guidelines. Okay, we're on the next page. You want to make sure,
Is it this one?
yes,
Yeah.
cool. You want to place the film as far away from the tooth as possible. Let's demonstrate that. You can just type it on here. Okay, as far away towards the center. So I'm gonna come in to the mouth like this, and I'm gonna move it back into the right area and have them bite. Can you see how far away from the tooth that
Mm-hmm.
film is?
Yep.
I'll show, okay. It's more towards the center of the mouth, okay? Distance makes a difference, remember, because of the inverse square law. Okay. Here's another part to be highlighted. As the patient closes on the bite block, relax your grip on the handle and slide the locator ring till it is about a half an inch from the face. So that's how far it should be from the face for the inverse square law to be in effect. So the ring is half an inch from the face. So when we're back there and I go half an inch from the face, half an inch from the face, you're gonna say, what?
Huh?
What? And I'm gonna say, put the ring half an inch from the face. So you want it to be pretty close. You can see in the picture, the second picture there, that she's got it pretty close to the face. Okay? After placing the film, you're gonna adjust the tube position. The positioning indicating device should point at right angles to the film. Right angles means 90 degrees, perpendicular, okay, to the long axis of the tooth. You want it to be both horizontally and vertically. The central beam should be placed at the center of the tooth. Now the central beam is what?
The center of the
The
primary.
center of the primary beam, that's right. It's the center of the primary beam. So if you imagine, you imagine an imaginary beam,
Like this. This is the primary beam, this would be the.
exactly, just like the straw, yep, that's great, Taylor, excellent. It's like, this is the beam and this is the primary, the central beam. It works,
Hey.
that'll work. That's a great analogy, I'm gonna have to use it. Again, I've stolen,
Perfect.
I will steal from you.
That's okay.
Then you're gonna position yourself where?
6 to 8 feet from the tube.
Behind the barrier or 6 to 8 feet from the tube head, away from the beam, keeping the beam behind you all the time. Okay, since you have already set the controls for the exposure, simply press the exposure button. What happens when we push the exposure button? Let's review a little bit.
Filament.
We're-
Is it
We're gonna
on the
send what?
electrons.
Electrons are gonna
from
get
the
excited
cathode,
from the cathode
shoot them to the anode.
to the tungsten target.
Mhm. X-rays are emitted
X-rays are emitted.
through a small hole
Uh-huh.
because everything else is soaked up, I guess, from
Filter, the aluminum filter soaks up the long rays,
through the
leaving the short penetrating X-rays to come out in a primary beam. Okay, excellent, good job. You're gonna return to the patient, and while stabilizing, you're gonna pull the ring back and remove the film from the patient's mouth. You always stabilize whenever you're closing it to the mouth, towards the face, or back. Otherwise, you can pull the whole thing, and it can be painful. It can be uncomfortable for the patient, so you don't want that. You're gonna return to the patient while stabilizing the post with one hand, slide the ring out the end of the post with the other. You're gonna carefully remove the holder from the patient's mouth. You're gonna use the paper towel. You're gonna remove the film, kind of wipe it a little bit, and put it in the cup. Okay? In the cup for transport to the dark room. Okay, that's how you take an X-ray.
So, do you have to take the cup out of the room before you do the next X-ray?
No.
Oh, I
You put
didn't-
you
okay.
put all 20 of them in that cup.
So you just can't pre-expose ones that haven't been.
Once
like-
they go in the cup, they don't come out until they go in the dark room.
Okay, I was just wondering because it's like you can get contrast by having the film exposed to radiation. So I was just wondering if it affects
That's why it's in.
after.
That's why it's in the adjacent room, so that it doesn't get exposed again.
Okay.
Okay. That's why it's in a different room.
Mm-hmm.
Okay. At least 6 feet away, if not in another room. At least 6 feet away, so that it's not exposed multiple times. Yeah. That's a good question. Very good question. And I think we need to take a quick break. Can you stop us? I need a quick break.